Hey there, it's Dr. Appalraju, your downtown digital general dentist. Today's talk is all about cracking teeth. Why is it that teeth tend to break or crack? Well, there's obvious. We see this a lot over the years. Sometimes people fall, they have an injury or trauma, and typically they're going to crack a tooth. Or maybe they've been in a car accident or an ATV accident, and sometimes they will chip or break something, but I'm not talking about that. I'm talking about what we see more often than that. Other than trauma, the most common reason people seem to be breaking teeth is because they have some large fillings in the back, and those fillings tend to weaken your teeth. Typically, they have a bad bite, meaning the teeth are not positioned properly, so there's some unusual forces in their system. Now, many of the patients that we've seen over the years that have fractured, physically broken a piece of their tooth off, they typically have a large amalgam or metal filling that was done when they were a teen or a kid. And then we see them in their 30s, 40s, 50s, sometimes even the 60s, and there's multiple cracks in other teeth. But the tooth that broke has a large metal filling, and we can observe. We'll often take a scan or we'll take a photo so you can see exactly what we're talking about. There are lines and stress lines in those teeth. Now, I like to use analogies. So if you just imagine you're driving on the highway and you get a rock chip on your car, one of those tiny little rocks hits your windscreen, creates a little defect in your windscreen. Well, if you don't fix it, you keep driving around. Well, typically over a few weeks to a few months, depending on the climate, meaning if it's hot or cold, that crack will propagate. It'll get much larger over time. And eventually, if you were to drive probably long enough or get another rock chip, significantly weakens your windscreen. Well, it's similar with your teeth. You see, when you have a large filling on your tooth, especially in the back, on the molars or premolars, in the back of your mouth, well, all these forces you apply to your teeth. Just think every day your teeth are touching thousands of times when you swallow. You eat food, you're biting on certain food items. Some people chew ice or eat very hard food items. Chewing on bones, eating popcorn kernels, corn nuts, these types of things create stresses in the system, and these cracks will propagate and eventually something will break. Sometimes we see patients that have symptoms, meaning their teeth are extremely sensitive or very painful to bite. As soon as they bite and open, the pain goes away. Well, this is a sign of a tooth that's cracking and needs immediate treatment. If you continue to bite on it, it will break. It's just a matter of time. Typically, our innate system is our mouth will protect us, meaning we will avoid biting on those teeth and we'll start chewing on other areas. But typically, what we will see when we scan our patients with our 3D scanner is that we will see heavy forces on these teeth because the teeth are not lined up properly. Now, there are some other patients who are heavy clenchers or grinders. They have very heavy stress in their lives because of family, because of work, because of post-traumatic stress. Patients that suffer from chronic pain, for example, will tend to clench and grind heavily in their sleep. So those forces get magnified when you're sleeping. Now you're putting them on your teeth. And remember, those weakened teeth with the large, typically metal fillings, they tend to fracture. So this is often what we see. So if you think you're having this problem, you're having sensitivity, pain on biting, maybe you've had an experience where a tooth broke and you needed to get it crowned. Well, this is something that we assess on all our new patients when we scan them, take photos, and assess their bite forces and what's happening with them personally through lifestyle and social factors. So if you are interested in learning more about this, or maybe you think this is happening to you and want to be assessed further, we'd love to see you. Reach out to our team. You can call us directly or go directly to our website and hit the Book Now button. It takes you 2 minutes, and you can do that 24/7 any time of the year and get into our schedule. We'd love to see you, and then we can discuss this a little further. Now, if you find this video was useful for you and maybe you can like it for us, that would be fantastic. Then we would know we're on the right track and we're giving you some information that's valuable to you. If somebody in your family or a loved one needs to hear this, perhaps you can forward it on to them. And in the meantime, stay well. We'd love to see you at our clinic. Take care. Bye for now.